So what do we do to restore range of motion in this patient? So the process is very similar to this patient prior to surgery, okay? So every session, we like to measure the range of motion at the session start, get an idea of how it's progressing to see if we're giving too much exercise or not enough exercise. We make our decisions based on the progress over the course of time, okay? And that's going to dictate the tolerance to exercise too. So if you're getting stiffer, there's a chance you're giving that patient too much and or they're not doing their exercises, right? So you kind of have to parse that out and figure what the problem is, okay? So to work on extension, I'll do some soft tissue work to the gastroc as well as the hamstring to promote more knee extension. And if we're really limited into knee flexion, I do more work to the quad, right? Patellar mobs, superior and inferior. So inferior mobs are more for knee flexion. Superior mobs are more for knee extension, okay? So you can choose which mobilization to do more of based on where your limitations lie. And I also do basic range of motion with overpressure. So I may seated knee extension at the end of the table for flexion. And then for knee extension, just the patient lying supine on their back, their heel propped up, me pressing into more extension with my hand over their kneecap, right? We also prescribe a lot of homework. I like constant, frequent, low intensity motion with the priority on restoring extension. And I like to prescribe my patients quad sets, terminal knee extensions, and assisted knee extensions. So the patient sits with their heel propped up and they extend their own knee with a little bit of overpressure from their hand. I like a lot of frequency here, right? Frequency over intensity. So we're doing these exercises 3 to 5 times a day, right? Even up to every hour, right? To really improve that range of motion. You got to watch out for pain and swelling. If you're doing a little too much, then you may get more stiff, more painful, more swollen. That's not what we want. And the other piece is that if you're not having progress with this plan, you can also add some low load, long duration stretching, which would be the patient lying supine on their back with a foam roller or some sort of prop underneath the heel. And then you have an ankle weight starting with a light weight above the kneecap, pushing that knee into more extension. Okay. You usually start with about 10 minutes per day, but you can work your way up to 60 minutes per day. So I stole this from Lenny Macrina, and he actually recommends 3 by 20-minute sessions of low load, long duration stretching with a light ankle weight above the knee for those stubborn knee extension folks that just aren't regaining the range quickly after surgery. In terms of flexion, we're trying to do the same thing. So we're doing constant, frequent, low intensity motion. For flexion, this is typically heel slides, seated knee bends, chair knee bends. Basically choosing 1 to 2 exercises that are comfortable and convenient, doing this 3 to 5 times a day for 10 to 15 repetitions and just watching for swelling and pain. If it's getting too painful, too swollen, we might have to back off a little bit over the course of time. Like I said, flexion is not quite as important as the extension. And some folks, they're very, very stubborn with their flexion range of motion. And you may decide to employ some of the low load, long duration stretching as well. We have this chair, this torture chair called a flexionator in our office where it just bends your knee. There's a crank that bends your knee and you just sit with a low level stretch for a long period of time, which is pretty god awful, but it is effective. You can also do the same thing with a chair close to the wall where you kind of bend your knee with assistance from the wall and just maintain that bend for a period. You can also do it seated at a chair where you bend your own knee and just hold that for a period of time as well, which is helpful for folks that are maybe working for the majority of the day and they just want a nice stretch on that and they're a little stubborn in terms of improving their flexion range. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons. It's going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.